Just when we thought Asia and the Pacific had managed to control recent coronavirus outbreaks, many are now taking a turn for the worse. Australia, previously a poster child for its handling of the pandemic, declared a state of disaster in Melbourne as cases there rise. And in Hong Kong, life was starting to resemble pre-pandemic times before a sudden surge prompted new social distancing measures. Medical experts there say that this regional pattern of optimism replaced with rounds of lockdowns should sound a warning to the rest of the world. Here's ABC's Britt Clennet.
While the United States continues to battle its first wave, across the world in Hong Kong, the virus was kept at bay for 6 months, with no reported cases in nearly a month, all despite sharing a border with mainland China, where the coronavirus first emerged. But it's now hunkering down again, hit by a third wave, its most widespread yet. This fresh spate of cases starting in July, taking the city by surprise. Professor Ben Cowling is a leading epidemiologist at Hong Kong University and advisor to the World Health Organization.
So by April and then May and June, we had very few local infections in Hong Kong.
So what went wrong then? Where was Hong Kong vulnerable?
So we were vulnerable because once those social distancing measures were relaxed, as soon as some local infections came back into the city, there'll be a chance for infection to spread because we'd relaxed the social distancing measures.
Flaws in the city's quarantine system were also apparent, with more than 250,000 people exempted from isolation, including airplane crew and seafarers. Measures are now ramped up. Mandatory mask wearing for indoor and outdoor public spaces, even when exercising, gatherings of no more than 2 people, and for the first time ever, a brief blanket ban on dining.
Hong Kong is a very crowded place and public spaces are quite hard to come by. So as you can see, as I walk around some of the public areas, you can see people eating food just in the parks here. Really, it's a case of trying to find wherever they can to sit and eat their food, grab a takeaway lunch.
After seeing these images, the government quickly reversed course, ending a breakfast and lunchtime indoor dining ban. Inside hospital wards, doctors warn of overcrowding.
This wave of outbreak in Hong Kong is much more closer to what happened in Western country a couple of months ago. We have more elderly got infected, we have higher mortality, and actually we cannot get all of them into the hospital because most of our isolation facilities are fully occupied.
Hong Kong opening a makeshift isolation facility at its huge convention site not far from the airport.
We're going to have 500 beds there. So we'll ask those young confirmed cases who are who are relatively well to stay there and get their treatment.
But while cases are rising in Hong Kong, the death toll here is a far cry from the US, with 37 COVID-19 deaths recorded in Hong Kong since the pandemic began. Most of those deaths, however, came in the month of July alone. Hong Kong's sharp spike, part of a pattern across Asia. With Vietnam looking at its first major outbreak, new cases snapped a more than 3-month streak without a single case, locking down the tourism hotspot of Da Nang, and the country's now seeing its first deaths. A new spike rising in Tokyo just as it began easing measures in July, surpassing its rate earlier in the spring. And a growing outbreak in Melbourne, Australia. A strict new 6-week lockdown gets underway as it's declared a state of disaster.
I think it's clear from what's happening in Asia that second waves are going to occur elsewhere in the world. As public health measures are lifted, COVID is going to come back, it's going to resurge.
We need to adapt a very simple social life for a long while if we really want to get this disease under control.
For the first time in the pandemic, mainland Chinese health officials are helping out in Hong Kong, a team of healthcare workers arriving from the mainland on Sunday. The cooperation receiving some scorn at a politically turbulent time. The government postponing legislative elections slated for September by a year, citing coronavirus concerns, as critics say they're attempting to silence the pro-democracy movement.
The schedule of the election, in the context of public health issue, I can't find any reason for delayed it, especially you say delayed it for a year. So I think it is solely a political decision.
Hong Kong not only dealing with a political crisis, but now a renewed health crisis as well. While Asia, the first to be impacted by the outbreak, is now a cautionary warning to the rest of the world of what's likely to come. Britt Clennet, ABC News, Hong Kong.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.